So if you look at it keenly, having grown up and worked within the health space in Kibera, I saw it as an opportunity, me and my fellow educators and other artists, as a mean that we can just use to sensitize our communities effectively, because the traditional methods of forum sometimes fail to connect with the young audiences or young people. So with theater, everyone wants to get involved, everyone has a story they can relate to. And this is one of the reasons why we use theater. Yes.
Cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen and I'll be your host. Let's roll!
Greetings and welcome to another episode of the African NCD Champions podcast, where we meet and talk to incredible people working in the non-communicable diseases space in Africa. In this mini-series, we are featuring the Young Health Program, a program implemented by Plan International in Kenya and funded through the AstraZeneca. This program focuses on improving literacy, improving policy and access to services in line with non-communicable diseases and sexual and reproductive health. In Kenya, the program is being implemented in Kibera and Mathare, which are the largest slum areas in the country with the largest need for such services. The program has been implemented for over 10 years, or for about 10 years, and today we'll be talking to one of the individuals from Kibera who's been working on this program throughout the 10-year period, telling us about his experiences, his approaches to health communication, and without further ado, Paul, give us an introduction to yourself, your name, what you do, and how you got to be here.
Yeah, thank you, Steve. My name is Paul Odongo. I am a lead peer educator working with the Young Health Program in Kibera. So I've been in Young Health Program for about 9 years now. And within the program, I've come to learn a lot about the health spaces and how to interact well with my community. And at this, I think one of the greatest achievements we've had towards getting communities engaged within this particular space is the use of theater. So today we are going to explore more on that. And
Yeah, sure thing. So let's already jump into that. You're using theater as an approach to do health education. So talk to us about why you chose theater as an approach to do health education activities within the Young Health Program, and how did that idea come to life?
yeah, I think one of the biggest reasons is because theater tells stories about people's lives, about the interactions, and if you look at it keenly, this is a medium that can really bring communities together, because once you use theater, everyone can relate across different age groups, across different ethnicities. So with that, we found theater to be one of the most powerful tools you can use when passing health information and health education in our community. So if you look at it keenly, having grown up and worked within the health space in Kibera, I saw it as an opportunity, me and my fellow educators and other artists, as a mean that we can just use to sensitize our communities effectively, because the traditional methods of forum sometimes fail to connect young audiences or young people. So with theatre, everyone wants to get involved. Everyone has a story they can relate to. And this is one of the reasons why we use theatre. Yes.
I see. So you've said very clearly that young people, normally the traditional sit and learn approach sometimes doesn't work.
Yes.
And theatre makes it much easier for people to engage because of the power of storytelling.
Yes.
So I wanted to follow up to find out, how does theatre enhance community engagement in the health education, and in what ways does theatre facilitate deeper community involvement and understanding of NCD prevention?
Yeah, I think theatre in itself has a variety of modes or methods you use when implementing it. Particularly within the communities, we use what we call PET, in full, that's participatory educative theatre. And with that, the audiences, they just don't watch, they're immersed within the particular activity that's going on. So per se, let's say within the community, we are having an engagement, and the first part of PET is entertainment. So these might come in the form of cultural dances, and you find people will want to just move to the beats and
join the
and sing along. Yes, that in itself has gotten somebody already immersed within the activity of the theatre. So when we see, we have that first part done, we have a part which has education, and that comes in the form of a skit. So the skit can display something, let's say a risk factor like tobacco use, harmful use of alcohol, physical inactivity. So when we have that particular skit packaged, again, somebody can relate this to something that they have been seeing within the community. So with that, sometimes there's a pause where the audiences are brought in as actors. So the entire script is paused midway, and then you have an audience come in and you give them a particular role. And that in itself gives them the lived experience of having to act it out. And most of the times you find that this invokes something that they already feel is a need within the community, or an experience they have lived themselves or they have seen within the community. So a good example is once we had a woman getting to solve the nutritional needs of the children she had within the homestead. So we just gave the woman a role. If you are the one cooking, what will you be cooking to ensure that your children get a healthy diet? This particular woman corrected what had been acted earlier. And with that, we saw that the information that had been passed about healthy diets has already sunk in. So you have given them the information. When they get to the part where they act it out, it reinforces what they have already learned through the skit.
Yeah. So what are some of the memorable events that you can remember during the 9-year period, that these are some of the, throughout our theatre engagement, these are some key highlights that we've seen in the engagement with the communities?
There are several, but one of the most memorable ones is we had a theatre activity, PET, going on. At the same time, we were having a blood pressure screening camp going on. So the common norms within the community is that NCDs only affect the elderly. And these are some of the myths and misconceptions we try to address under Young Health Program, and with the interventions we have like the theatre. We try to change such mindsets so that young people can embrace healthy practices, even going to the local health facilities just to screen. So when we were having this particular event, I remember a young person who had outright said that he cannot go for the screening because it is meant for the elderly. After watching the theater performance, and then he was glued there for like the entire period of time, he was able to go and visit the screening camp, and for sure his blood pressure was high, so he got a referral, and immediately, because we were doing it next to a health facility, he went into the health facility. Following up, he had high blood pressure, which had not been screened for before, and now he's continuing medication as because some of the CHPs we have continued to follow up with him. This is very powerful for me because I feel the norms and the misconceptions and the myths that have sunk within the community, preventing healthy practices to be taken up, are now being broken. Yeah,
it's interesting to see how change can happen almost instantly, because with theatre, you're actually involved as it happens. You're part of the performance, as we said earlier on. I guess the follow-up question is, in your approach to use theatre and to use creativity as a way to talk about health communication, what are some of the challenges that you face in the community?
Yeah, one of the biggest challenges in using this approach is the balance between entertainment and giving information, because sometimes when you use fiction in your information just to be able to enhance entertainment, sometimes that's what sinks in more than the
information itself.
Yes. So over time we have come to notice that there's a need to strike a balance between the entertainment part and the information giving part, or the educated part of our performances. So with this, we have curated the scripts of the skits to be able to suit information that is factual and information that is in line with Young Health program. So this enhances the information giving part more, to as much as we have the entertainment segment, but we are also able to strike a balance between it and the education part. I think one of the other things with community theatre is financing. And with this, we are trying to explore a couple of avenues where we can get financing to be able to make it a sustainable venture, so that we may reach a larger part of the community, even past the villages that are being covered by Young Health program. Yes.
Yeah. So in Kibera, which is the largest slum area in the country, actually on the continent, there's a lot of people living in there, and a lot of people come to watch you use theatre as a way to educate them on non-communicable diseases and its risk factors and sexual reproductive health as part of the Young Health program. I'm curious to know where else have you been able to use this approach to be able to really do the education, and have there been some significant members of the audience who joined and viewed your performances?
Yeah, when our group started, we started within Kibera, very small. But as we progressed, we got to meet, like for example, Young Health program has been able to give us the platform to perform within our community. And this has given us viewership of different audiences. So with that, we got a link to curate and create performances fit for the Kenya National Theatre. And afterwards, we have also been able to get even international performances. So the group is growing thanks to the interventions we have had. And that's why we are very hopeful as we continue to create pieces that create change within our community. We will also get larger viewership of people who are like-minded and want to create impact within the communities, so that we are able to work together to better our communities.
Cool. So last question is around is what would be your key messages, especially to health programs or individuals who are creating health programs and primarily utilizing the traditional approaches for health communication? What would be a message to them on especially how they can think wider and bring these new interventions, and how do you convince them with results that actually using participatory theatre and using more creative ways that the lecture style, sit and talk approach works better?
Yeah, and that's a tricky question, but looking at it from my perspective, I think the thing to understand here is communities are dynamic, different needs and ever changing. For example, today you'll come with a method that really works, tomorrow it might not really suit the situation. So that is something to come prepared and understand with a full understanding of. With theatre, we are able to be dynamic as well. As the communities change, our pieces change. The songs maybe that one generation can clearly relate to are not the songs another one will. So theatre really accommodates this dynamics within the community spaces, and that's why I think complementing it with the other methods of passing health information is really important, because now you won't have one method working, but you'll have a variety of methods to tackle different angles of the dynamics. For me, that's something that people working within this sector need to really explore, because when you want to reach audiences, especially the young people, their needs keep varying. They, for example, they always follow the trends. So that is something to really consider, especially when you want to reach them as your particular target audience. Yes.
Thank you very much for those feedback and remarks, and that brings us to the end of this first part of this conversation. To everyone watching, thank you very much for watching, for joining us. I hope you've learned a little bit more about different approaches for health communication, and case in study today, participatory theatre and using theatre as a means to educate communities. We will be having a part 2 of this conversation where we'll be going deeper into some of the stories. But with that, thank you very much and see you on the next one.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storylink and at NCD Champions. See you on the next one.